Okay, hello. Maybe you could just introduce yourself to everyone.
Good morning, everyone. My name is Paul Dorian. I'm a cardiologist at St. Michael's Hospital and a professor of medicine at the University of Toronto. And I have a longstanding interest in cardiac arrest from the clinical epidemiologic perspective and with respect to research working with emergency medical services to measure and increase the rates of resuscitation from cardiac arrest.
Great, thank you very much. And I am Roberta Scott, and I'm the CCO of the AED Foundation Ontario. So today we just have a couple questions we're going to ask Dr. Dorian. So the first question for you, Dr. Dorian, is why is a provincial AED registry important, and what will it do for sudden cardiac arrest survival?
I think all the listeners and viewers and the population needs to understand that the best chance of survival from cardiac arrest is the availability of immediate resuscitation efforts, usually from bystanders that are around. And typically, this would involve doing CPR and calling 911 and delivering a defibrillator to the scene, since most patients who have a cardiac arrest in a public and often in a private place are suffering from a life-threatening, fast cardiac rhythm called ventricular fibrillation. We know that it takes, on the average, anywhere from 6 to 10 minutes between the time somebody calls for help for 911 and the paramedics actually arrive on scene and can deliver this life-saving treatment, which is a defibrillation, an electrical shock to the heart. On the other hand, bystanders or lay individuals can deliver this life-saving treatment themselves if a device called an automatic external defibrillator, or AED, is readily available. Now, we know there are many, many AEDs in public places, in movie theaters, in stores, in shopping centers, in gyms, in public buildings, in apartment buildings, in a lot of places. These are generally bought for and deployed by the owners of the building or the administrators, for example, in public places. In order for this AED to be effectively used, the individuals who are prepared to and are capable of deploying and using the AEDs need to be able to find them. It's important to note that if an AED is used, the chances of saving somebody, saving a life in this life-threatening situation is probably about 75%, which is much, much better than the approximately 25% chance of survival if the paramedics that are really well trained and they're doing all the right things, but if the paramedics arrive, generally it's too late, unfortunately. So that in addition to starting CPR and calling 911, if a defibrillator is available, it's really important that bystanders be able to identify, find, locate, and use these defibrillators. The problem, of course, is that if somebody has a cardiac arrest and you're at the Eden Center, for example, in Toronto, or in some public building or a gym, you don't know where the device is. And you need to be able to find it. In order to find it, there needs to be, think of it as a telephone book, a registry, a listing of the location of these devices, and also some means of communicating this information to the individual that's attending to the person with cardiac arrest. That's a complicated process, but it starts with having a secure knowledge, which we do not have as of today, of is there a defibrillator nearby? And if there is, where is it? And where can I find it if I'm attending to a person with cardiac arrest? Hence the need for a registry or a listing of the precise location and distribution, if you like, of defibrillators so that individuals can be instructed where to find them in case of need.
Thank you so much. That's absolutely perfect answer. It gives a whole picture of why this is so important, this AED registry in the province of Ontario. So thank you, Dr. Dorian. One more question for you, and that is, why is research an important component of an AED registry?
Well, there's lots we know, and as often is the case in medical science, lots we don't know. So we do know that the vast majority of cardiac arrests in a public place happen because somebody has developed an unexpected life-threatening heart rhythm disturbance called ventricular fibrillation. We also know that the best treatment for this person, the treatment that has to be delivered to save their life, is an electric shock from a defibrillator. What we don't know is the best means to get the defibrillator to the patient and make sure that it is used. That requires all of having defibrillators nearby, Secondly, for the individual to be able to find out where the defibrillators are, to have a means of somebody fetching the defibrillator and bringing it to the side of the individual. We don't know how that's best done. Is it sending somebody to get it? Is it the bystander getting it? Is it somebody bringing the defibrillator there? We just don't understand that part of it. And also, very importantly, even if the defibrillator or when the defibrillator appears at the side of the patient, these devices are pretty easy to use. You can teach a grade 6 student in about 10 minutes how to use a defibrillator. It's pretty intuitive and it gives verbal prompts. Nevertheless, it takes a bit of courage and experience and thinking about it in order to actually deploy this technology. It's very safe, but many people think that there's potential risks and they're reluctant or afraid or concerned or uncertain. This is a very high stress situation where somebody is kind of unconscious and needs this particular kind of help. So we need some research to try to understand how best to prepare and educate the potential witnesses and bystanders so that they can use this life-saving technology.
Great, thank you very much, Dr. Dorian. That's a lot of very important information that I think the average person probably isn't aware of. So thank you for discussing this issue with us. And yeah, we really appreciate your support in this issue. Thank you very
My
much.
great pleasure. And carry on with your good work.
Thank you. Have a good day.
All right, take care.